Hi, I am Dr. Mariana Colmenares, a breastfeeding and lactation specialist. Today, we will address a common myth between breastfeeding and low milk supply. Many mothers worry when their baby wants to feed all the time, thinking they're not producing enough milk. As someone who works with breastfeeding babies daily, I want to explain how typical feeds look like and why frequent feeding is completely normal. To make sure a baby is getting enough milk, we should look at some key indicators. As the milk comes in, which usually happens the first 72 hours, expect at least 5 wet nappies daily and frequent bowel movements. It is very important to notice changes in the stool color, which transitions from dark brown or black to a green and then a yellow color in the first 5 days of life. Babies will usually regain their birth weight by day 10 or 14, though in some cases this can be up to the 3rd week. We expect babies to gain around 20 grams per day between the age of 5 to 4 months of life, though in some cases this can be lower. A loss of more than 10% of the weight, or in older children, the grade loss greater than 2 centiles on their growth charts is often an indicator of inadequate milk supply. But we may also see other signs at the breast, such as fussiness, prolonged feeding, and increased feeding frequency. If weight loss persists, accompanied by signs like fewer nappies, lethargy, or poor weight gain, despite frequent feeds, further assessment might be needed. As a clinician, I will always consider the change in baby's weight alongside with these other signs. Babies need frequent feeding because the milk is digested quickly and the baby's stomachs are very small. Feeding also helps regulate other systems and metabolism. Breastfeeding is not just about nutrition. There are individual factors that impact directly on the frequency of the feeds. Babies will typically feed between 8 to 12 times daily, but the interval between the feeds can vary. Sometimes baby feed because of hunger, but sometimes it's thirst. And there are other needs, such as closeness, warmth, and these are called non-nutritive feed. Growth spurts often increase feeding frequency, commonly occurring at the end of the first month and again at 3 months. Cluster feedings, which are several feeds close together, is a natural and biological mechanism that helps your baby signal your body to increase and maintain milk supply. However, if a baby is frequently crying, fussy at the breast, or excessively sleepy during the feeds, they should be evaluated. As a pediatrician and breastfeeding doctor, I assess both the baby and the mother. I evaluate the mother's background, general health, medications, breast tissue, pregnancy, and for the baby, I will evaluate baby's mouth, the latching, their overall health. It is important to determine whether there is a true milk supply issue, and if there is, it can be addressed through improving latch and positioning, optimizing feeding frequency, and sometimes medications. If low milk supply cannot be solved, which is rare, your doctor can help you develop an appropriate supplementary breastfeeding plan while still preserving your breast milk supply as much as possible and protecting your breastfeeding journey. Remember, increased feeding alone rarely indicates a problem. If your baby is gaining weight, has plenty of wet nappies, and looks happy, your milk supply is likely perfectly adequate. Trust your body. It is physiologically designed to respond to your baby's needs through an amazing supply and demand feedback mechanism. Questions? Leave them on comments or contact us on Instagram.